Hi, I'm Dr. Paul Ruff at West End Plastic Surgery, and I want to introduce you all to something that is new, exciting, I think actually has a significant amount of potential within our world aesthetically and regeneratively. It's called Renuva. This is what it is. It comes from a nonprofit group called the Musculoskeletal Tissue Foundation. It is an adipose matrix. It is designed to put a scaffold and stimulators into areas either for both rejuvenation and in what we're going to see today from a little contour irregularity from an older liposuction site, and will be replaced by your own fat cells. This takes about 3 months to take effect. Tissue regeneration does continue for up to about 24 months. Usually we look at it at about 3 months to see if a secondary treatment is warranted or necessary, but it is usable for the face, the hands, contour irregularities, buttocks, hip dips, almost anywhere where we have or need fat because of some type of loss or need for more fat. So let's take a look at our patient. In the standing, it is harder to see sitting, but in the standing, we have a little contour irregularity right here. It's a little depression. She has fairly thin, slender thighs. There is some tissue here and around it. The goal is to replace the area with the adipose matrix, which will then allow for rejuvenation and regeneration over time, improving the overall tone, texture, and appearance. And oftentimes we see skin quality improvement in conjunction with these. The process is essentially no different than the typical fillers that we use, the hyaluronic acids, Sculptra, calcium hydroxyapatite, any of those. So we'll get to it. Renuva comes packaged, so we'll open the package, and there's an accessory kit because we need to process it just a little bit to make it flow better for injection. And then the Renuva. This is what it looks like. There is no actual fat in here. It is really stimulators as well as a bit of a scaffold in which it comes. So we're going to take the secondary syringe and put the flange on top of that. Remove the cap. Put that right in there. And then we want to slowly push it back and forth. This makes this a more smooth, even injection. We want to do this approximately 10 or slightly more times until it passes between the two syringes smoothly and evenly. This ensures that when we inject it, it will inject smoothly and evenly as well. Okay, so we're going to take that out, and now I'll get ready for my injection. Prep the skin with a little bit of Puricin, alcohol wipes. Start this way. The depth of it is right here. If we pass our fingers over, we can feel where the indentation is, and we will layer from there. So we're going to do a little bit of pinch. And pass. And come up in a little bit more of a superficial, sequentially filling this area to create a bit of a scaffold. I'm going to come back from this direction. Pinch, and done. As far as aftercare, patients are asked not to do any strenuous or significantly strenuous activity for the next 24 hours. Patients can use ice, ibuprofen, Tylenol for any discomfort. Return to all normal and basic activities right away. If we're doing this for the face, I don't recommend putting any makeup on for about 12 to 24 hours, minimizing any potential effects from substances getting into the small puncture holes. Other than that, this should be fairly straightforward and easy to perform in the midst of the busy lives that we all lead.